if we look at the question whether infections related to suicide and look through the medical literature, there's some literature on toxoplasmosis and suicide. And then there was recently some research in Scandinavia where they looked at a large database of patients, and patients that were recently hospitalized had a higher incidence of suicide. Also people with pulmonary conditions. So it does appear that chronic infections correlated statistically with a higher risk of suicide compared to people that in a matched control did not have these chronic infections. That can be explained by the physiology, and I could go into that if you want. It's when someone has a chronic infection, it provokes the immune system. They're in a more pro-inflammatory state. That has a cascade of effects, increasing usually quinolinic acid, which is neurotoxic, and that can impact glutamate functioning, and that in turn seems to affect neural circuitry, which the orbital frontal cortex, the cingulate, the amygdala circuit then can be impaired, and you see this correlation with infections, immune provocation, dysfunction of neural circuitry, and higher risk for suicide. Of course, many things contribute to suicide or deter us or acutely trigger it, but this is one cause that we previously never paid attention to that we need to pay more attention to.